Treat That Pain is a series of brief presentations on the essentials of managing cancer pain with special emphasis on safe and rational use of narcotic medications. It's an initiative of the National Cancer Grid India. Every attempt has been made to keep the contents evidence-based. This presentation focuses on the unmet needs of cancer pain management within cancer care programs in India. Metaphorically speaking, cancer pain may be seen as the elephant in the room in cancer care settings. It's an important, enormous problem that is obvious to all, yet how often it is that it neither gets acknowledged nor gets reflected in the assessments, prescriptions, and care plans. Pain is prevalent across all types of cancer. This table depicts the information from two studies, one of them based in India. It can be noted that several cancers from different sites, including gastrointestinal, lung, head and neck, gynecological, or breast, have moderate to severe pain in nearly 60% of their patient population. It's important to note that cancer pain can be severe irrespective of the stage of the disease. This figure depicts the results of an international study done on prevalence of cancer pain. It is noteworthy that even at stage 1, patients, almost 1/4 of the patients experienced moderate to severe pain, indicating the need for prescribing the appropriate group of medicines which work for severe cancer pain. This multicentric landmark study done across 4 regional cancer centers in India at Cuttack, Kolkata, Hyderabad, and Ahmedabad looked at the prevalence of cancer pain from oncology inpatient and outpatient settings and noted the severity of pain and the adequacy of clinical responses. All 4 centers had in-house palliative care capacities. Researchers found that 88% of the 1,600 patients surveyed had experienced pain in the last 7 days, of which 60% were significant. Nearly 90% of newly registered outpatients had pain as a presenting symptom, and of these, nearly 80% received inadequate analgesic prescription. Interestingly, the adequacy of pain management varied significantly with the severity of pain reported at these centers. While mild pains were well managed, more than 80% of moderate pain and more than 94% of severe pains, that is, an unacceptable majority of patients received inadequate analgesic treatment. What does this mean? The processes for relieving pain at the centers under study failed as the severity of cancer pain worsened. That was an India-based study. The 2 studies shown here examined the prevalence of pain in cancer patients at a global level and represent meta-analytical information on the subject from 1967 until 2015, that is nearly 50 years. The same research team that conducted and published the study in 2007 published the update in 2016. They observed that despite increased attention on assessment, management, and availability of effective analgesics, cancer pain continues to be a highly prevalent symptom, highly distressful concern, and the needless suffering due to cancer pain stays unchanged over the past 50 years. Pain has an inbuilt avoidance to it. When pain does not respond to the initial efforts with analgesic therapy, the persistent distress of the patient impacts on the clinician's sense of self-efficacy and alters the deep concern and empathy for caring into complacency and sometimes even to avoidance and occasionally to hostility. When cancer pain is poorly controlled, the therapeutic relationship suffers and the care suffers. The adherence to treatment, the outcomes, and survival are poorer. At patient level, the distress due to constant pain affects daily activities, functions, and impacts the social roles of the patient. The patient in constant pain alienates all around, including family and friends, and loses the much needed social support during that critical period. Unaddressed pain thus undermines the very purpose of cancer care, which is return to health and life. The Lancet Commission on Global Access to Palliative Care and Pain Relief 2017 describes health-related suffering and its seriousness when it compromises physical, social, and emotional functioning. The Commission reports the enormity of health-related human suffering, with more than 61 million people in 2015 alone as having experienced serious health-related suffering. In the Lancet report, pain along with fatigue, anxiety, and low mood contributed to 75% of all health-related suffering. It describes unrelieved cancer pain as a substantial contributor. This aspect of the suffering, at least, can be alleviated once comprehensive cancer care expands its scope and includes pain relief as a non-negotiable outcome of all care plans. What if we are able to control the pain well? The intensity of pain is an important determinant of health-related quality of life. Adequate analgesia improves the quality of life, and higher the quality of life, better the adherence to anti-neoplastic therapy, less number of unexpected admissions, and there is a positive impact on survival.